Well, I will present a study, Personality and Attachment, Evolution of a Population in Impatience. We tried to measure personality traces with a short version of MMP, the Minimalt, and about attachment. I think we all know the quadrants of attachment. The 4 patterns of attachment: secure, preoccupied, dismissed, avoidant, and 2 underlying dimensions: anxiety and abandon, and avoidance of close relationship. Positive, secure; negative, preoccupied, avoidant, dismissed. The objectives of this study was to correlate personality traces with attachment and to compare attachment at admission in the clinic to attachment at the high. Related to methodology, our sample was constituted by 22 inpatients in Senhor da Serra Clinic in the treatment of addictions program. The mean of ages were 45 and the mean of clinical stay was 23 days. We had 7 women and 50 men, and 15% of the person were married, 41 were single, and 9% were divorced. We used the Addiction Severity Index to measure the severity in alcohol, in drugs, familiar problems, social problems, legal problems, and medical problems. Minimalt, to evaluate the personality traits, and experience in close relationship to evaluate the attachment. The proceedings, the sample was collected in Clínica Senhor da Serra between February and September this year. The assessment at the time of admission in the clinic and at the time of the high. It was made self-report questionnaires and the structured interview, the AZ. This participation was voluntary, anonymous, and confidential. Results. What do we have about attachment? People in the admission at the clinic were more preoccupied. In the high, there are no significant difference, but are differences. So I think it's something to reflect on. We are talking about a median of 23 days, a treatment that is 28 days, and our changes to preoccupied to secure. In average, the avoidant dimension of attachment patterns of the patients remain unchanged. But in average, there was a reduction of the preoccupied dimension of the attachment patterns. The result is not statistically relevant, but is clinical relevant. About the correlation of personality traces and attachment, there was a significant negative correlation between the avoidant dimension of the attachment pattern at the admission only. Depression, hysteria, paranoia, and schizophrenia. What can you think about that? People with more avoidance of attachment decrease their negative evaluation of themselves, which is congruent with the positive model of self and the negative model of the other, which is characteristic of avoidance. At the end of this treatment, model is challenged by exposure therapies, and so the correlation are no longer significant. Thank you.